Hi, Kevin Henry, Managing Editor of Dental Economics, here today with Dr. Michael Schuster from the Schuster Center in Scottsdale, Arizona. And we're going to talk a little bit today about the importance of block scheduling and the 80-20 principle.
Okay.
So, I know a lot of dentists really aren't doing block scheduling. Why is that such a big thing to you?
Well, block scheduling immediately gets to what's the highest and best use of my time? What's the highest and best use of my practice's time? So it starts off with the idea that 20% of what we do produces 80% of the results we have. Now, this is not necessarily true in every kind of business and every kind of practice, because if we're dealing with a specialist theoretically has already eliminated a lot of the other things that go on and is really focusing on doing that which is in the highest and best use of his or her time. But when we look at a general practice and we look at the mix of services that a general practice is doing, having evaluated thousands of practices, every general practice is doing about 8 to 10 things over and over and over. So I've often said, you know, if you're only doing one denture a month, it probably doesn't make any difference what you're charging for it. But if you're doing 10 a month, it probably makes a big difference because it's consuming more of your time. So first, the 80-20 gets to, okay, if 20% or 10% of what I'm doing is producing 80 to 90% of my results, why aren't I focusing on it? So the idea of block scheduling is something that I've been doing myself in my own practice and recommending for 30-some years. And so it goes something like this. My A work, which has been my blue time. So when I block, I color code. My blue time is the highest and best use of my time, of my skills and my capabilities. My B work is, and I put that in green. I don't care what color people use, but green. That's all the activities that I have to do to be able to do A. And the C stuff is the stuff that I'd rather not do at all. I'd rather somebody else do that or delegate that. Sure. So when you get into block scheduling a practice, you know, you have to have some ideal that you're shooting for. And so I may put in my ideal, because let's say a week from today, I have a block schedule for that day of what I want. But if I haven't filled that schedule, then a week I can break it down. But if I don't hold that ideal of what I'm after, it never happens. So then I just get busy. And I may be busy, but I'm not productive. At the end of the day, I'm worn out because I'm not doing, you know, what I really need to do or really want to do. So block scheduling, you know, in any practice that I have worked with, when they really get into it, it automatically increases productivity 15 to 20%, period, or more. I've had people say, well, it's far more than that. But it's at least 15 to 20% increase of productivity. Not only that, but if I am putting into my schedule stuff I want to do, I'm feeling good about what I'm doing. So if I have enough of what I want to do, then I kind of begin to crowd out what I don't want to do, or delegate it, or have someone else do it. So it gets to Pareto's principle, which it can even be, and Pareto was an Italian that developed the whole idea, when he figured out that 98% of the wealth of Italy was in the hands of 2% of the population. So wealth, like time, is unequally distributed. So it comes back, I have to say, well, what's the highest and best use of my time? I've got to list that. So if I look at my procedures, if I look at what I'm doing, if I look at how I'm spending my time, I automatically say, well, how do I create the most value for my practice? How do I create the most value in people's lives? That becomes my A time. Okay. And so what I want to do, there's a great book by Stephen Rockschotten, a physician, entitled Time Shifting. And what Rockschotten, and I heard him lecture a couple times, and I really resonated with him. He said, you know, you have these islands of happiness. You have these things that you do in your life that you just love doing, the things that really turn your crank. He said what you want to do is expand those. So what I want to do, if I could, I want to have the majority of my time spent in A time. Okay. So if I could have 60% of my time spent in A, or 70%, and 20 or 30% spent in B time, which is really planning and doing those things I need to do A, I'm going to become far more productive. In other words, I'm going to do more with less. Okay. If I'm not block scheduling, if I'm not 80-20ing, then I'm going to be doing less with more. I'm going to be seeing more people, I'm going to be doing more procedures, I'm going to be busier and busier and busier, but in reality, I'm going to be doing less.
And I know one question probably everybody's thinking that's watching this right now is, what kind of process is it to change over to a block scheduling? Is it pretty laborious? Is it something that isn't that difficult to do?
I think it requires, that's a great question. I think, you know, when I think of block scheduling, and I do, you know, today, I recommend people block schedule out of their practice as well. And the Google Calendar, I mean, I sound like I'm selling Google Calendar, but the Google Calendar is phenomenal for that. Because I can schedule one part of my life in one color, I can schedule another part of my life in another color, and so I'm sure that it's not overlapping. So I first have to really think through if I'm thinking about my practice, I'm thinking, okay, how do I create the most value for people in my practice? What do I really love to do? What am I really good at? You know, what really turns my crank, okay? So when you say, is it difficult? No, but I've got to do that, and then I've got to figure out what other things do I need to be doing so that I can do A. And what are the things I really don't want to do? What do I want to delegate? What do I want to refer?
Right.
And so what I want to try to do then, when I do that, I'm going to block it. And then it may take a while for that to really begin to happen, but I have to have the intention and I have to know what I'm going to be putting into those spaces, and gradually it fills in. Okay?
All right. Thanks.
Thank you.